My name is Lisa Wiggins. I'm a behavioral scientist at the Centers for Disease Control and Prevention, also known as CDC. I had the honor of working with Dr. Li for the past 20 years on autism surveillance and research projects funded by CDC. Ching was a brilliant scientist, but more importantly, she was a kind, compassionate, and considerate individual. She truly valued multidisciplinary collaboration and integrated thoughts and ideas from different fields into her work, which inspired her colleagues and strengthened her overall impact. Ching also brought a broad socio-cultural perspective to all of her projects. She encouraged her colleagues to think about how culture shapes development and how we can use data to support individuals with autism and other developmental disabilities and their families throughout the lifespan. Ching's contributions to the fields of mental health, child development, and epidemiology are far from realized. She will continue to inspire our work and the work of many others for years to come. Ching is truly missed.
Hi, everyone. My name is Audrey Thurm, and I want to pay special tribute to Ching, who I met in 2003 when she first joined Johns Hopkins, when Craig Newshafer introduced us, and she helped me with the statistics for my master's thesis, which I was publishing. And it was one of the first projects she worked on in autism with her new job. And she was the most enthusiastic, detail-oriented, friendly, and cheerful person to be around. We became friends instantly, talked about many other things. She cared so much about her work, the people around her, helping the field, and expanding the work globally that you'll, I'm sure, hear more about. She brought the perspective that we needed to make our work helpful to the field immediately and make sure that we not just help those in this country, but beyond. I miss Ching very much.
Hello, I am a researcher at Children's Hospital of Philadelphia, and I would like to pay tribute to the memory of Ching Li. I met Ching when I was part of the research network for ADAM, Autism and Developmental Disabilities Monitoring Network, and SEED, Study to Explore Early Development. I have very fond memories of Ching. She was a great collaborator. Regardless of how busy she was always willing and able to pitch in and support our efforts to improve our insights into the characterization of autism to enable improvement in care. She is greatly missed.
I'm Rebecca Landa from Kennedy Krieger Institute, and Ching Li was a close and treasured colleague of mine. There were so many things about Ching that set her apart from everyone else, and one was her pure generosity and humility. She wanted to make life better for all human beings around the globe. She went out of her way to honor people, to bring people together. One of the things that I think set her apart professionally was her knowledge of temperament, her real understanding of statistic and epidemiology, and she brought all these pieces of knowledge together to really shed new light on the way we think about autism and the way we understand how to approach autism and making the world a better place for autistic people through a public health approach. So I'll miss her forever and treasure her also and hold dear all the things that she...
I am Andy Zimmerman, a pediatric neurologist, now retired from the University of Massachusetts Medical School. Words cannot express the deep loss that my wife Susan and I have felt since the death of Ching Li last year. She was a very dear friend and colleague for 17 years, part of our wedding party in 2010, and rescued our recent clinical trial when our statistical team failed us. She was tenacious to the end, right up until the study was published a few days following her untimely death. I first got to know Li Ching through our study of HLA types in families with autism spectrum disorder about 2004 at Hopkins and Kennedy Krieger Institute. Her quick insight into the data that my colleagues and I had collected was so impressive. When we first met, in less than an hour, she outlined the analytic approaches we would use with her keen insight and knowledge of autism, with what I soon learned was her typical good humor and great intellect. The study had languished for want of her expertise and energy, and she was reluctant to be first author on the paper, which she clearly deserved. In many studies and papers to follow, Li Ching always gave her utmost to produce the most complete analyses and coherent discussions possible. She could turn any ordinary study into a masterpiece.
My name is Parul Christian, and I'm a professor in the Department of International Health and the director of the Human Nutrition Program. I was introduced to and knew Li Ching since 2011 when we first met to discuss and collaborate on a prevalence and risk factors study of autism in our population study site located in rural Bangladesh. She was a recognized world expert on autism for low and middle income countries. And when I met her, she immediately struck me as a kind, attentive, gracious, and an unassuming individual. At Hopkins, our nutrition group has been doing micronutrient and maternal and child health research in the northwestern region of Bangladesh in collaboration with colleagues in Bangladesh. And our research project site called Javida was established in 2000. So in 2011, we had this opportunity and funding to follow a birth cohort of children whose mothers had participated in a research trial of vitamin A supplementation. Li Ching joined our team to lead this effort as an expert in autism, bringing really scientific rigor in assessment of ASD, using tests that had not previously been used in Bangladesh. It was a long and challenging study requiring rigorous training in ASD testing. And throughout its conduct, her knowledge, her patience, insights, and cultural acumen for working in a rural South Asian context were really very commendable. Of course, without her expertise and networks, we could not have done this exciting study of screening over 8,000 children in this rural population and testing them to estimate the population level burden of autism and its risk factors in this environment. So on behalf of our entire Javida team in Bangladesh, including Dr. Hashmat Ali, Hafiz, Professor Naila Khan, and JHU colleagues, including Keith West, Lee Wu, Ellen Lebrick, we are deeply saddened to lose our dear colleague and friend in Li Ching. And I speak on their behalf in thanking her for all her various contributions and dedicated work on autism. She is dearly missed.
Hi, I'm Marie Diener West, the chair of the Master of Public Health program at the Johns Hopkins Bloomberg School of Public Health. I have had the great privilege and pleasure of interacting with Li Ching through our MPH students. Over the past 15 years, Li Ching has served as a committed academic advisor for 15 students and a capstone advisor for 12 students whose interests were in epidemiology and autism. More so, Li Ching taught a required epidemiology course that was taken by hundreds of our online MPH students. I will never forget the kindness and compassion that she showed all students and her sincere desire for all students to succeed. She is missed. Thank you.
Hello, my name is Keith West. I'm the George Grant Professor of Infant and Child Nutrition in the Department of International Health. I knew Li Ching over the course of the past decade, working together with a team here at Hopkins and in Bangladesh to carry out the first population-based survey of autism in 8 to 10-year-old children in rural Bangladesh. Li Ching was an amazing collaborator. She was our technical expert. She knew all of the steps for certifying the protocols and for getting all of the permissions and for training the staff that needed to carry out the work. She was just a wonderful person to work with. She was kind, gentle, always interested, attentive, and somebody that we will miss dearly. Her contributions will go on for years and years in South Asia as autism is increasingly investigated in the future.